I should like to welcome you all to the Human Immunome AI Summit, presented by the Human Immunome Project, and send my regrets that I'm not there in person. I'm sitting in Melbourne, Australia, where, as I record this, we're coming to the end of winter. Today, you have an extraordinary opportunity to lay out a cross-disciplinary strategic vision for the field of immunology and how to take advantage of rapidly changing technologies to solve major scientific problems, central to how we do research and combat disease. I expect that the conclusions you reach will probably go beyond immunology and set a baseline for the study of other problems. Decoding and harnessing the human immune system is one of the great frontiers of biomedicine. The human immune system is involved in nearly every major disease, stretching across infectious disease, but also non-communicable diseases like cancers, autoimmune disease, heart disease, and neurodegenerative diseases like Alzheimer's. All of these have an inflammatory component, which is partly driven by the specific immune response and partly involves what we think of as the effectors of innate immunity, the macrophage, monocytes, and so forth that invade into tissue sites of pathology. All of this comes under the heading of immunology and is all approached through the human immunome. It's a massive area of investigation and what is really the most complex of all our biological systems. A Human Immunome Project could have an even greater impact than the Human Genome Project when we think specifically in terms of human health and longevity. There is a renaissance occurring in the field of human immunology, driven by advances across systems biology, structural biology, and advanced computing. In addition to that, the need to deal with COVID-19 and to try to understand the pathogenesis of this extremely complex disease has greatly advanced our dissection of what is actually happening and in a severe and in some situations, what looks to be a persistent infection. The resources that have been poured into trying to deal with COVID-19 have allowed us to advance a lot of the immunological techniques we developed, for instance, in mouse model systems, and now really apply them in human beings who are suffering infection or have been involved in, say, vaccine trials and various other efforts to try to counter this disease process. We've seen great collaboration between physicians and basic scientists, and the data is just coming through on what is actually happening in the acute confrontation between SARS-CoV-2, the cause of COVID-19, and in the complex disease process we call long COVID, which is debilitating very large numbers of people in the long term. And we truly do not understand what is happening here. We're getting great readouts, but the readouts are so complex that we need to handle this in ways that go beyond our usual system of trying to think things through. AI has revolutionized many areas of industry and society. We now have the tools to do so in science and biomedicine. An AI model of the human immunome may revolutionize biomedical discovery and transform therapeutic and vaccine development and enable people to live longer and healthier lives. But we first have to do the work. Building this AI model will move science into the digital age and catalyze 21st century medicine, because immunology goes right across medicine. The time has come from a Human Immunome Project to help solve some of the biggest questions in immunology and science. Science advances when we cross intellectual barriers and bring innovative investigators who may actually speak very different science language and command very different technologies. When we bring people like that together and they start to try to understand the various issues that bedevil different fields and where the great advantages are. That's what we're aiming for here, a dialogue and discussion between people with very different expertise that will come forward with a synthesis of how to move this forward in ways that use the optimum of modern technology and intellectual discussion. Maybe we'll be changing the world here. Maybe we can set a model for how to do this, because it's always a challenging ask to interface two major fields. Have a great meeting. I've no doubt that this will be a terrific event, and I look forward to reading the recommendations and your conclusions.